Hello everyone, I'm Dr. Liu from the Department of Pathology. Nice to meet you again. Today we will begin to introduce a new chapter, Local Circulatory Disturbances. Section 1 is on hyperemia and congestion. Below we have the major objectives. Define congestion and hyperemia. Describe their morphologic appearance, and state their causes and consequences. Now, let's consider some scenarios. Which one of the scenarios below best illustrates the concept of active hyperemia? A. A 22-year-old third-year medical student who develops a red face after being asked a question during a lecture. B. A 67-year-old man who develops venous distension of the leg due to heart failure. C. A 71-year-old woman who develops mucosal hemorrhage due to a deficiency of vitamin C. Which one is correct? I hope you will be able to choose correctly after this session. The terms hyperemia and congestion both indicate a local increase in blood volume of a particular tissue. Hyperemia comes from two root words. Hyper means increased, and emia is related to blood. Hyperemia and congestion are sometimes used synonymously. However, hyperemia is always used to describe an increased volume of blood as a result of an active process. We also call it active hyperemia. Venous hyperemia is also known as passive hyperemia or congestion consequent to a passive process. Therefore, hyperemia usually refers to arterial hyperemia, and congestion usually refers to venous hyperemia. Let's look at this picture. The left one illustrates normal blood circulation. Blood flows into the arterial, then capillary, and venule. The middle one shows arterial hyperemia with increased inflow of blood. The left one reveals venous congestion with decreased outflow of blood. Arterial hyperemia means active arteriolar dilatation resulting in enhanced blood flow into local capillary beds. Here, we should pay attention that it is an active process, and the cause is arteriolar dilatation. It can be physiological or pathological. Blushing from embarrassment or flushing after heavy exercise is active hyperemia due to physiological response. Physiological hyperemia is a neurogenic response mediated by the autonomic nervous system. Pathological hyperemia usually occurs in the early stage of local acute inflammation. Chemical mediators such as histamine, serotonin, and kinin released during inflammation act on endothelia and smooth muscle cells to cause active hyperemia. When we put a tourniquet on a limb to briefly stop the blood circulation and then release the tourniquet, we can see a local hyperemic response. Hyperemic tissue looks bright red because of the extra oxygenated blood. The tissue feels warm due to the enhanced metabolism. If hyperemia is prolonged, there may also be tissue swelling. This picture shows the pathological hyperemia in mastitis. Active hyperemia is usually transient and mostly resolves when the stimulus is removed. However, it might lead to severe consequences in patients with hypertension or atherosclerosis. These patients have high blood pressure and or damaged blood vessel wall. Hyperemia may lead to rupture of the blood vessels. Venous congestion means an increased amount of blood in an organ or tissue resulting from venous obstruction, compression, or from cardiac failure. Compared to arterial hyperemia, venous congestion is clinically more significant. Local venous compression, such as in interception or a tumor compressing surrounding veins, leads to congestion. What can you see from this picture? Yes, it is a picture from a patient with interception. In this condition, a segment of the intestine falls into another segment, which will lead to mesenteric vein compression, showing congestion of serosal or mucosal veins. Local or systemic venous obstruction is the result of occlusion of the venous lumen. Commonly, it is due to formation of a blood clot. This picture shows a nervous thrombus blocking its lumen. The third etiology of congestion is cardiac failure, which is common and important. Can you recall the circulatory system arrangements in our body? Well, please look at this schematic diagram. We have systemic and pulmonary circulations. For systemic circulation, blood from the left ventricle goes through the body, then flows back to right atrium. For the pulmonary circuit, blood from the right ventricle goes through the lungs, then flows into the left atrium. When there is a right-sided heart failure, which circulation will be affected? Yes, right-sided heart failure will affect the systemic circulation. Blood accumulated in the right heart affects venous blood returning from the systemic circulation. When there is a left-sided heart failure, the pulmonary circulation will be affected. In conclusion, the etiologies of congestion can be summarized as outside compression, inside obstruction, and heart failure. Now, let's turn to the appearance of a congested tissue and organ. Because venous blood is not well oxygenated, the congested tissue is bluish red. One can also find tissue swelling. This picture shows the congestion of the lung. Microscopically, we can see dilatation of veins and local capillary beds full of blood cells. In this picture, we have acute congestion of the lungs. Acute pulmonary congestion is marked by blood engorged alveolar capillaries and intra-alveolar hemorrhage and edema. Venous congestion is often chronic. This would lead to atrophic degeneration and even necrosis of cells due to poor nutrition and oxygenation. Parenchymal cell necrosis leads to interstitial fibrosis. Severe congestion results in hemorrhage and deposits of hemocysteine in affected tissues. Therefore, the tissue appears brown and indurated. In some cases, prolonged chronic congestion will lead to the formation of new channels between the congested vein and other venous drainage beds. That is, diversion of blood flow. For example, in people with chronic obstruction to the portal venous system, blood cannot flow normally through portal veins, so the blood will flow to the esophageal venous system instead. These people develop varices in the lower esophageal veins. This picture shows the engorged and dilated veins forming esophageal varices. Now, let's look at these scenarios again. Which one is active hyperemia? Yes, A is correct. It illustrates blushing from shyness or embarrassment. It is a physiological hyperemia. B is congestion due to heart failure, and C is hemorrhage. Here are the references. Next time, we will discuss two important clinical conditions of congestion. Thank you.